All right, you guys, welcome. Welcome to another podcast. Today is episode 14 in season 12. Today is Wednesday, July 31st, 2024. My name is Sonal Patel, and this is the Paint the Medical Picture podcast series. Now, all right, you guys, you heard some of that new creative change that I've been playing around with, right? So some of that is new background music. I've also been creating new cover art for the podcast. I've also refreshed my YouTube channel for Paint the Medical Picture as well. So be sure to pop on over there and check out my latest videos. Now, the podcast format is definitely going to be changing up as well as the season progresses, as the month goes by. But of course, you guys know you're all my loyal fans, so the majority of you should know that I'm knocking on year 4 of the podcast. So during the month of September, I will definitely be sharing with you when that year 4 happens, and I cannot wait to celebrate that with all of you. And I also wanted to give a big shout out to the country of Egypt, because guess what? It's my first time making it onto your top 10 charts for business news. So I'm so grateful, so thankful to be featured on your top 10 charts as well. All right, you guys, let's get into today's episode. Now, you know, it's the very last Wednesday of the month, so it's going to feature my Newsworthy fraud, waste, and abuse highlights for the month of June. And of course, I'll be spotlighting some of those from the month's criminal and civil enforcement cases that I find newsworthy. And in my Trusty Tip today, I'm going to be going over the G codes for opioid treatment services. And of course, to close out and round out today's episode, I'm going to end it with another remarkable quote on collaboration by Simon Mainwaring. Today's episode is sponsored by Advanced Coding Services. Whether you're just starting out or a seasoned professional, our training equips you with the tools and support you need to advance your career. Our medical billing and coding school meets your needs worldwide, online or in person, with one-on-one support throughout your training. We're committed to helping our alumni and credentialed medical community in keeping up their certifications by offering various avenues for acquiring your continuing education units. In addition to our Mastering the Business of Medicine retreats, offered several times throughout the year in different parts of the country, we now offer memberships. You can conveniently earn your CEUs by attending our exclusive members-only webinars. Since our aim is to nurture and grow the careers of individuals who work in the business of medicine, we call our member area the Apple Orchard. Advanced Coding Services. Educate, nurture, inspire, reaching back with a hand up. All right, guys, let's get into it. So let's get into today's Newsworthy, that month of fraud, waste, and abuse. All those cases in the month of July. July saw a whopping 52 cases as of the recording of this episode. Early July saw home health providers to pay $4.5 million to resolve alleged False Claims Act liability for providing kickbacks to assisted living facilities and doctors. 3 home health agencies operating in the states of Texas, Ohio, and Indiana, along with their owner, Evolution Health LLC, together called The Companies, have agreed to pay over $4.4 million to resolve allegations that they violated the False Claims Act by knowingly providing illegal kickbacks to assisted living facilities and physicians in exchange for Medicare referrals. Now, this particular settlement resolves allegations that from the years 2013 through 2022, the 3 home health agencies provided lease payments and other valuable benefits, including wellness health services, sports tickets, and meals to numerous assisted living facilities and their residents, as well as certain healthcare providers in exchange for referrals of Medicare beneficiaries. The home health agencies then billed Medicare for the home health services they provided to the referred patients. The anti-kickback statute prohibits the provision of remuneration with the intent to induce referrals of government healthcare program business. The anti-kickback statute is intended to ensure that medical providers' judgments are not compromised by improper financial incentives. Claims that are knowingly submitted in violation of the anti-kickback statute are ineligible for payment and can violate the False Claims Act. The companies received credit under the department's guidelines for taking disclosure, cooperation, and remediation into account in False Claims Act cases. Among other actions, the companies disclosed the conduct to the government, identified the individuals involved, and assisted in the determination of losses caused to Medicare. The investigation and resolution of this matter illustrates the government's emphasis on combating healthcare fraud. One of the most powerful tools in this effort is the False Claims Act. Tips and complaints from all sources about potential fraud, waste and abuse, and mismanagement can be reported to the Department of Health and Human Services at 1-800-HHS-TIPS or 1-800-447-8477. The claims resolved by this settlement are allegations only, and there has been no determination of liability. Now, mid-July saw the Grand Healthcare System and 12 affiliated skilled nursing facilities to pay $21.3 million for allegedly providing and billing for fraudulent rehabilitation therapy services. Now, this company admits that supervisory officials falsified information in medical records. The Grand Healthcare System and 12 affiliated skilled nursing facilities, or SNFs, have agreed to resolve allegations that they violated the False Claims Act by knowingly billing federal health care programs for therapy services that were unreasonable, unnecessary, unskilled, or that simply did not occur as billed. The settlement resolves allegations that from as early as January 1st, 2014 to September 30th, 2019, the Grand knowingly submitted false claims for rehabilitation therapy for residents at 12 facilities that Strauss Ventures owned and operated. During this period, Medicare Part A, which is Medicare's hospital insurance, which also pays for care in SNFs in some circumstances, and TRICARE, which is the federal healthcare program for the Department of Defense, or the DoD. Now, they paid for such services at rates that varied based on the number of minutes of skilled rehabilitation therapy provided. The Grand alleged that submitted bills where the reimbursement claimed was based on providing more therapy than was reasonable and necessary, or in some cases where the therapist did not provide the amount of therapy reported. Now, as part of the greater settlement, the Grand admitted that certain now former Grand management level employees implemented quotas that each of the 12 facilities was expected to reach, including quotas relating to beneficiaries' lengths of stay and to the percentage of beneficiaries billed at the highest reimbursement level. To meet these quotas, facilities often scheduled patients to receive therapy without consideration of what was reasonable and necessary based on the individual patient's clinical condition. In addition, the Grand directed that no more than 3 patients be discharged from any facility per week and instructed that no Medicare Part A patients should be discharged from rehabilitation therapy unless it had been discussed with corporate officials. The Grand admitted that this resulted in some Medicare beneficiaries, quote, staying on therapy longer than was reasonable and medically necessary, end quote. The Grand acknowledged that there were various instances where supervisory officials who did not personally evaluate or treat patients set or adjusted the number of minutes of therapy that a Medicare patient would receive. The Grand also acknowledged that there were instances where supervisory personnel falsified the number of therapy minutes in the Grand's electronic record-keeping system or instructed subordinates to do so well after the therapy was allegedly rendered. The settlement also resolves federal allegations that the Grand submitted false claims to Medicaid for services rendered at its New York nursing home location between January 1st of 2016 through June 30th, 2021. These claims were allegedly false because the reimbursement rate was inflated by data inaccurately reflecting the degree of care, including rehabilitation therapy services needed by Medicaid patients located in New York. Now, the grant has also entered into a 5-year corporate integrity agreement with the HHS-OIG that requires an independent review organization, or an IRO, to annually assess the medical necessity and appropriateness of therapy services billed to Medicare. The settlement resolves a whistleblower lawsuit filed under the qui tam provisions of the False Claims Act by 2 former providers of rehabilitation therapy at the Grand. The act allows private persons to file civil actions on behalf of the government and share in any recovery. Under this particular settlement, the whistleblowers will receive approximately $4 million of the settlement proceeds. Now, moving on. Mid-July also saw Kindred and related entities agree to pay $19.428 million to settle federal and state False Claims Act lawsuits alleging ineligible claims for hospice patients. Gentiva, a successor to Kindred at Home, has agreed to pay $19.428 million to resolve allegations that Kindred at Home and its related entities, collectively known here as Kindred, that they knowingly submitted false claims and knowingly retained overpayments for hospice services provided to patients who were ineligible to receive hospice benefits under various federal health care programs. Gentiva's hospice operations, which are headquartered in Atlanta, Georgia, include entities that previously operated Kindred at Home hospice locations under the names of Avalon, Kindred, Southern Care, and Southern Care New Beacon. The settlement resolves allegations made by the United States and the state of Tennessee in a consolidated complaint filed in 2021 against certain Kindred-related entities, alleging that from the years 2010 until February 2020, the defendants knowingly submitted or caused to be submitted false claims for hospice services provided to Avalon hospice patients in Tennessee who were ineligible for Medicare or Medicaid hospice benefit because they were not terminally ill. The settlement also resolves the complaint's allegations that these defendants improperly concealed or avoided Avalon's obligation to repay those hospice claims. In addition, the settlement resolves allegations that certain Kindred Southern Care and Southern Care New Beacon hospice locations knowingly submitted or caused to be submitted false claims for hospice services provided to patients who were ineligible for hospice benefits under Medicare and other federal health care programs because those patients were not terminally ill. Those hospice locations included were in the states of Rhode Island, Texas, Missouri, Alabama, Indiana, and Ohio. The settlement also resolves allegations that those Kindred, Southern Care, and Southern Care New Beacon locations knowingly and improperly concealed or avoided obligations to repay the foregoing hospice claims. Further, the settlement resolves allegations that Southern Care New Beacon allegedly violated the anti-kickback statute by willfully paying remuneration to a consulting physician between October 1st of 2016 and October 1st of 2022 to induce hospice referrals of Medicare beneficiaries to its Alabama location. The settlement of those allegations stems from a voluntary self-disclosure made by Southern Care New Beacon Hospice. The anti-kickback statute prohibits offering, paying, soliciting, or receiving remuneration to induce referrals of items or services covered by Medicare, Medicaid, and other federally funded healthcare programs. It is intended to ensure that medical providers' judgments are not compromised by improper financial incentives and are instead based on the best interests of their patients. The settlement includes the resolution of claims in 9 lawsuits brought under the qui tam, or whistleblower provisions of the False Claims Act, by various current and former Kindred employees. Under those provisions, a private party can file an action on behalf of the United States and receive a portion of any recovery. The share of the settlement to be received by the whistleblowers has not yet been determined. The claims resolved by this particular settlement are allegations only. There has been no determination of liability. Now moving on. Late July saw an owner of a home health care company convicted of a multi-million-dollar health care fraud scheme. A female owner was convicted on Friday, July 19, 2024, following a 9-day jury trial in federal court in Boston, Massachusetts, in connection with the home healthcare fraud scheme. Now, she was convicted of 1 count of conspiracy to commit healthcare fraud, 1 count of healthcare fraud, and 3 counts of money laundering. The jury found this defendant not guilty on 1 count of money laundering conspiracy. Sentencing will be scheduled at a later date. She was arrested and charged along with her female co-defendant in February 2021. From January 2013 to January 2017, she was a part owner and operator of a home care services company. She and others engaged in a conspiracy to use the home healthcare company to defraud Mass Health of at least $100 million. Specifically, evidence at trial demonstrated that the home healthcare company failed to train staff, billed for home health services that were never provided or were not medically necessary, and billed for home health services that were not authorized. The home healthcare company, through this part owner, paid kickbacks for patient referrals, regardless of medical necessity. They also ordered and entered sham employment relationships with patients' family members to provide home health aid services that were not medically necessary and routinely billed for fictitious visits that she knew did not occur. She used the laundered proceeds of the $100 million scheme to purchase a new house and a new Maserati. Her co-defendant pleaded guilty to her role in the conspiracy in September 2022. She is scheduled to be sentenced on September 18, 2024, before a U.S. Senior District Court judge on the case. The charges of healthcare fraud, conspiracy to commit healthcare fraud, and money laundering each provide for a sentence of up to 10 years in prison, 3 years of supervised release, and a fine of up to $250,000 or twice the amount of the money involved in the laundering. Sentences are imposed by a federal district court judge based upon the U.S. sentencing guidelines and other statutory factors. Now, moving on, late July also saw a Santa Paula doctor who pleads guilty to healthcare fraud for his role in a hospice scam that bilked Medicare out of $3.2 million. A Ventura County physician who worked for 2 Pasadena hospices pleaded guilty to defrauding Medicare out of more than $3 million by billing the public health insurance program for medically unnecessary hospice services. He pleaded guilty to 1 count of healthcare fraud. And according to his plea agreement, from July 2016 to February 2019, the physician and a co-defendant schemed to defraud Medicare by submitting nearly $4 million in false and fraudulent claims for hospice services submitted by 2 hospice companies. The co-defendant controlled both of those companies. Medicare only covers hospice services for patients who are terminally ill, meaning that they have a life expectancy of 6 months or less if their illness ran its normal course. The physician falsely stated on claims forms that patients had terminal illnesses to make them eligible for hospice services covered by Medicare, typically adopting diagnoses provided to him by hospice employees, whether or not they were true. He did so even though he was not the patient's primary care physician and had not spoken to those primary care physicians about the patient's conditions. Medicare paid on those claims supported by his false evaluations and his false certifications, as well as his false recertifications of those patients. In total, approximately $3.9 million in fraudulent claims were submitted to Medicare, of which a total of approximately $3.289 million was paid. According to the Medical Board of California's records, he is a licensed physician in California, but has been on probation with the board since 2015 and is subject to limitations on his practice. The United States District Judge on the case scheduled an October 25th sentencing hearing, at which time he will face a statutory maximum sentence of 10 years in federal prison. The co-defendant remains at large. Yet another co-defendant who allegedly recruited patients for the hospice companies in exchange for illegal kickbacks has pleaded not guilty and is currently scheduled to go on trial on October 15th. Now, an indictment contains allegations that a defendant has committed a crime. Every defendant is presumed to be innocent until and unless proven guilty in court. Now, there were many of the other usual suspects as well, from even more False Claims Act cases, opioids and pills mills cases, pharmacy and laboratory schemes, as well as a couple of elder abuse cases. But I wanted to pay particular attention to a late July case involving Precision Lens, who have agreed to pay $12 million to the United States for kickbacks to doctors in violation of the False Claims Act. Now, Precision Lens and the estate of its former principal have agreed to pay the United States $12 million to resolve a case involving kickback payments to ophthalmic surgeons in violation of the False Claims Act and the anti-kickback statute. Now, on February 27, 2023, a federal civil jury found that Precision Lens violated the False Claims Act and the anti-kickback statute by paying kickbacks to ophthalmic surgeons to induce their use of Precision Lens products in cataract surgeries reimbursed by Medicare. Precision Lens provided kickbacks to physicians in the form of travel and entertainment, including high-end ski trips, fishing, golfing, hunting, sporting, and entertainment vacations, often at exclusive destinations. For many of those trips, physicians were transported to luxury vacation destinations on private jets, including trips to New York City to see a Broadway musical, the college football national championship game in Miami, Florida, as well as the Masters Tournament of Golf in Augusta, Georgia. Precision Lens sold frequent flyer miles to its physician customers at a significant discount, enabling those physicians to make personal and business trips at well below fair market value. The jury found that Precision Lens, their conduct resulted in over $43 million in fraudulent claims submitted to Medicare. By operation of the statute, the court entered into a over $487 million judgment against the company and its owner, which included treble damages and civil penalties under the False Claims Act. Following post-trial motions, the court reduced that judgment to over $200 million. After the United States conducted a review of the defendant's financial position and ability to satisfy the payment, the parties entered into a settlement agreement which requires Precision Lens and the estate to immediately pay $12 million to resolve the United States claims. With this resolution, the United States has collected nearly $27 million as a result of the misconduct alleged in this case. The civil settlement arises from a case brought, again, under the QTAM or whistleblower provisions of the False Claims Act. Under those provisions, a private party can file an action on behalf of the United States and receive a portion of recovery. And now it's time for my best practice tips in Trusty Tip. So, how do you bill compliantly for opioid treatment programs, or OTPs? When patients are receiving opioid treatment services, the opioid treatment programs get paid weekly. So, let's break it down. Medicare pays enrolled OTPs bundled payments for opioid use disorder, or OUD treatment, based on weekly episodes of care. So our professionals who can provide substance use counseling and individual and group therapy included in the bundled payment may include, but is not limited to, licensed clinical social workers, licensed professional counselors or mental health counselors, licensed marriage and family therapists, licensed clinical alcohol and drug counselors, any type of certified peer specialist, as well as other professionals permitted to give this type of therapy or counseling according to state law, as well as their own scope of practice. Now, be mindful, there's no copayment for OTP services for Medicare patients, but the Part B deductible does apply. So please check your patient's Medicare eligibility. Now, if you're a clinician, Clinicians cannot use OTP codes to bill for office-based treatment. Now, there's a long list of G codes to use when billing for opioid use disorder services at OTPs. So be mindful and use the intake activity code, which is the add-on code G2076, only to bill for new patients starting their opioid use disorder treatment at an OTP for medically reasonable and medically necessary services. The G codes used for opioid use disorder services include HCPCS codes G0267 through G2075, as well as these add-on codes G2076 through G0137. And finally, I focus Season 12 Spark on collaboration. I want this 12th season Spark to be filled with our world's thought leaders, writers, artists, philosophers, everyone who inspires the need for better understanding of the need for collaboration. So in this week's inspiring quote in Spark is from Simon Mainwaring. Effectively, change is almost impossible without industry-wide collaboration, cooperation, and consensus. Absolutely true, right? This quote reminds us that change can happen when we work for a greater purpose. This quote encourages us to work hard, letting other voices be heard, other voices be celebrated. It is this collective, this collaborative effort that yields effective change, process improvements, betterment. I'm happy Simon Mainwaring's spark still shines on in all of us today. So that wraps up today's episode. And as always, I appreciate you all diving into today with me. If you want more information from me, please go ahead and follow me on LinkedIn. I'll leave links to everything in the show notes below. Now, all right, you guys, that's going to wrap up my month of July. Can you believe summer is almost over? But on a much happier note, the Olympics, the Summer Olympics are finally here. They've started up, right? And they're in Paris, of all places. Such a remarkable, remarkable city. I cannot wait to go there one day very, very soon. Now, Paris is ablaze with those athletes from all around the world. I'm so happy to see so many of my favorite sporting events in Paris. Now, all of their individual, their collective, and their collaborative efforts inspire all of us around the world. I'm looking forward to all the gold, silver, and bronze these next couple of weeks, right? All right, you guys, I hope you found your favorite to tune into. I wish you all an amazing and very, very happy week ahead. Thank you so much for listening on today's episode, and I hope every week with me brings you closer to helping your providers paint a masterpiece. See you next Wednesday.